How do biopsies help diagnose complex skin conditions? Have you ever wondered how doctors figure out what's going on with complex skin conditions? One of the key tools they use is a biopsy. A biopsy involves taking a small piece of skin from the area that seems problematic. This tiny sample is then examined under a microscope, allowing specialists to see detailed changes in the skin's structure and cells. This process is crucial because it helps identify specific abnormalities and confirm or rule out suspected diagnoses. There are several types of biopsies, including punch, shave, excisional, and incisional biopsies. Each method is designed to capture different types of tissue samples based on what the doctor needs to investigate. For instance, a punch biopsy removes a small cylindrical piece of skin, while an excisional biopsy takes out a larger section. Once the sample is collected, it is processed and examined, often using light microscopy. Special stains, like hematoxylin and eosin, are used to highlight important features in the cells, making it easier to spot issues like skin cancer or inflammatory diseases. In addition to traditional microscopy, some biopsies use immunofluorescence techniques. This method involves tagging antibodies with fluorescent dyes to detect specific immune responses or antigens in the skin. This is particularly useful for diagnosing autoimmune conditions, such as lupus erythematosus or pemphigoid. The combination of these techniques enhances the accuracy of diagnoses for complex skin conditions. Sometimes, a clinical examination alone isn't enough to determine the exact nature of a skin issue, especially when different conditions can look similar. In such cases, a biopsy provides objective evidence that helps doctors make informed treatment decisions. For example, it can distinguish between benign and malignant lesions or clarify the type of inflammatory skin disease present. The accuracy of a biopsy diagnosis relies on several factors. Choosing the right biopsy site, using the correct technique, and handling the specimen properly are all essential. Additionally, providing detailed clinical information to the pathologist is crucial for interpreting the results correctly. Close collaboration between dermatologists and pathologists ensures that biopsy findings are understood in the context of the patient's overall health. As technology advances, new tools like artificial intelligence and advanced imaging methods are starting to support traditional biopsy analysis. These innovations promise to improve diagnostic accuracy and efficiency, especially as skin cancer rates continue to rise. In summary, biopsies are vital for diagnosing complex skin conditions. They provide direct evidence of disease processes, enabling healthcare professionals to accurately identify skin cancers, inflammatory disorders, and autoimmune diseases. This leads to better treatment planning and improved outcomes for patients dealing with skin health concerns. Always remember, if you have questions about your skin, consulting a healthcare professional is the best course of action.